On behalf of HERA, I welcome you to the webinars on cities and health. And it's my great pleasure to start this session by asking you to actually switch off your cameras and mute your microphones because we are just starting. And I would like to introduce the four speakers of today. So we have Professor Mark Neubenhausen, who is working at ICE Global and is a world-leading expert in environmental exposure assessment, epidemiology, and health risk and impact assessment with a strong focus and interest in healthy urban living. So Mark, great that you join us. And then he will be followed by Dr. Audrey Denazel, who is a lecturer in air pollution at the Center of Environmental Policy at Imperial College. She conducts cutting-edge multidisciplinary research at the intersection of environmental sciences, health behavior, transportation, and urban planning. And Audrey, we were very much looking forward as you were really pioneering work on transportation. And then the third speaker will be Dr. Dorota Jarusinska, who works at the WHO European Center for Environment and Health in Bonn, and is leading there a program on environmental exposure and risks with a diverse portfolio covering a range of health-relevant environmental and occupational factors, including air pollution, chemical safety, and noise. And Dorota, to you, we owe that we have the and now the new WHO guidelines, which you coordinated and which is a major achievement for our field. And we really dearly thank you as scientists to have moved that forward. And then finally, I'll give the final presentation. And I'm working at Helmholtz Munich and am an epidemiologist focusing on long-term prospective cohort studies where we assess complex environmental exposures and want to understand molecular mechanism leading to disease and healthy aging. So without further ado, Mark will now start his presentation. The presentations are supposed to be around 12 minutes, and then we have 8 minutes for questions and answers. Please post your questions into the chat that we can kind of pick them up. And in the question session, please also put on your cameras and microphones and ask the questions. And now we are all switching cameras and microphones off to give Mark the floor.
Thanks so much for inviting me to talk about my favorite topic, cities and health. So I would like to give a short introduction of some of the health impacts that we see in cities and some of the work that we've been doing lately on it. Just to give you the context, just to make sure that we're all on the same level, we know that ambient air pollution's got a very large health impact. Estimates run from about 4 to 9 million deaths due to ambient air pollution in the world, depending which study you believe and what methodology. We know there are more than 3 million deaths because of the lack of physical activity. But also what we see in particular in low and middle income countries, a large number of traffic fatalities, over 1 million per year. So we've got great problems. And many of these kind of events are occurring in cities. We know that cities are great places to live for a variety of reasons, and many people live in cities nowadays. Europe, it's 80–90% here. But we also know that our cities are hotspots of air pollution and noise. We see heat island effects and also lack of green space often. They're all been associated with health effects. Furthermore, we have currently the climate crisis, or currently, I think for a long time, that will affect what's happening in our cities. We see still further population growth in some countries, but also population decline in others. And what we see particularly also here in Europe is the aging population. And then still we have people moving to the cities. Here in Europe, we've got many already, but low and middle income countries are still move towards them. And although I focus here on Europe, I mean, I think it's important to acknowledge. And then, of course, we've got the COVID-19 pandemic that has also an impact on cities directly and indirectly, because many changes are being made as a result of. And I would like to acknowledge also that often we talk about adults, and a lot of my presentation is on adults, but most children actually live in cities, and they're affected in many different ways. And this is our future generation. We know the current exposure that we experience in cities have an effect on their overall development, on their growth, respiratory health, cardiovascular health, etc., that they take with them into adulthood. And we need, too often we see that when we think about cities, it's for adults, but of course, our cities should be for children and designed for children. And that probably is a different city than we have at the moment. We understand now that there's a relationship between urban design, how people get around, how it leads to environmental exposures and lifestyle factors, how it then leads to morbidity and mortality. This is a very simplified framework to show the linkage between the different aspects. So, and what you see, for example, if you design and invest in a city for cars, you're going to get a lot of people that use the car. That leads to air pollution, to noise, heat island effects, more stress, less social contact, less physical activity, and as a result also disease and premature mortality. On the other side, if you invest in say active transportation and design the city for active transportation, you get more people walking or cycling, what leads to less of the environmental exposures and more physical activity, what of course prevents disease and also premature mortality. To give you some numbers, here in Barcelona, we did a few years ago a health impact assessment study to look at 5 transport planning related exposures, and found that they caused around 3,000 premature deaths each year. If you look at the distribution of them, most were contributed to the lack of physical activity that exists in the city. So people are not active enough, and that's what we see in many cities around the world. And then also what we see that around 600 deaths were due to air pollution and noise. Furthermore, almost 400 deaths through to heat island effects, and then more than 100 due to the lack of green space. Now, most of the time when people think about the impacts of transportation, they think about traffic injury deaths, and in Barcelona there are only 30 per year. But so is what you can see, the real impact of urban and transport planning is about 100 times larger than what we normally see in the official figures. Of course, this is not only Barcelona where we have the problem, but also in many other cities. We did earlier this year, we published a study where we looked at 1,000 cities around Europe, where we looked at the air pollution levels and tried to estimate what are the health impacts. This is for PM2.5. We know that the levels of PM2.5 are highest in some of the eastern countries, Eastern European countries like Poland, Czech Republic, because of the coal use, but then also northern Italy got higher levels. If you look at NO2, it's slightly different. We see this is dominated by cities that have a lot of traffic, motorized traffic, including Paris, Madrid, Barcelona, London to some extent. And then when we estimated how many deaths could we prevent if we reduce the air pollution levels in these 1,000 cities to levels of the city with the lowest level, we estimated that we could prevent around 120,000 deaths because due to the reduction in PM2.5, and 80,000 deaths for the reduction in NO2. So there's in total over 200,000 deaths could be prevented by lowering the air pollution levels. Now, as you all know, and what we hear later, the new WHO guidelines have been proposed, and implementing these new guidelines in our cities, in these 1,000 cities, would prevent around 109,000 deaths for PM2.5 and 57,000 deaths of NO2. So the great majority of the deaths that can be contributed to air pollution would be prevented by implementing the new WHO guidelines. And actually this morning, Gary Fuller described this in his Guardian article. I suggest you have a quick read of it. What are the benefits of improving air? And there is also a quote by Bert Brunegreef that we all know is saying that these new guidelines look fairly tight, but he believes also that we could achieve them. It will take some time, but they are achievable, like some of the other old guidelines have been achieved in a number of places as well. We did the same looking at green space. We know that many cities don't have enough green space, or people don't live close enough to green space. The World Health Organization recommends having a green space of at least 0.5 hectares within 300 meters of the residence, and many people don't get it. We know there are many benefits of green space. It prevents premature mortality, it reduces cardiovascular disease, it reduces poor mental health, it's good for brain development, for children. In this study, we focused on premature mortality and found that in these 1,000 cities, we could prevent 43,000 deaths each year if we would degreen the cities up to the level that the WHO recommends. So as you can see, again, great benefits of improving the city environment. If you would like to know a bit more about your city, go to our website, isglobalranking.org, where the numbers are given for the 1,000 cities, both for green space and for air pollution. At least now cities can't say we don't know what is the health impact of green space and air pollution. Before they may have had this excuse, but now they can't say anything and they should take action. We're still trying to update the website also with noise and heat island effects, but the work is slightly delayed. So we need to look for solutions, and these are some of them. We need to look at land use changes, reduce car dependency, move to public and active transportation, and green our cities, to give a few possible solutions for this. One of my favorite one is the change in land use. At the moment, our cities are dominated by cars, even though that car use is not often the main transport mode, because they take up so much space, and particularly at rush hour. I mean, that's why we dedicate so much space to the car, why we should reduce it. Now, here are a few new urban models that could be implemented actually to reduce car use and promote active and public transportation. So first of all, the low traffic neighborhoods in London that have been implemented by cutting off the streets. What we have here in Barcelona is the Superblocks. On the left side, you can see the current situation, one-way systems up and down, left and right for motorized traffic. The Superblocks would cut 4 junctions in a block of 9 and only allow active transportation in there, walking and cycling. And we estimated that you could prevent almost 700 deaths per year if you would implement 500 Superblocks in Barcelona. The other one that gets a lot of traction is the 50-minute city in Paris. Carlos Moreno suggested this to make sure that all people's destinations, including work, school, cultural events, shops, are within 15-minute walk or cycling of the people's residences. And this really requires a rethink of how we use the city and where people are actually living. But I think it's a great approach, a great model to improve our current city life. And finally, there's the other one is the car-free city. Vauban in Freiburg is a car-free neighborhood. And it's also green and no cars allowed, a lot of active transportation. So these are kind of, inspirational, aspirational models for the future that cities should be looking at. But perhaps what is, first of all, here is the Superblock, just to give you an example what it looks like. On the top is one Superblock in Sant Antonio, what it was before, at the bottom what it was after, so with more green space, people walking and no cars. Perhaps though what is easier to implement and what we should look at, I think, as a quick measure, is to go introduce the 30-kilometer hour speed limit throughout our cities. And yesterday, for the four big cities in the Netherlands asked the government to implement the 30-kilometer per hour speed limit within their city boundaries. I mean, at the moment, I think they were saying that in the streets already 50% are 30 kilometers per hour, but they want to have it in all the streets, all the roads in the cities. And I think that will be a great improvement in the cities, because, you know, it will affect livability, health, and also sustainability. And it brings the active transport users much closer to the motorized transport users. And it should be fairly easy to implement. Of course, what's more difficult to enforce it. I always love this picture. I think this is where we're looking for, getting people to cycle more. Of course, I'm biased. I'm from the Netherlands, but this is a picture of Utrecht. I think this is what our city should be aiming for. And of course, changes are always possible. I mean, there are good examples, like this is Seoul, where on the left side you saw they had first the motorway. They got rid of the motorway and put a green space and a river in there, with much smaller space for the car, a much nicer and healthier environment to be in. This is the Alderey Hospital, Children's Hospital in Liverpool. On the left side, you see what the old hospital with a park next to it. They asked the children, what do you want? And they said, they had to build a new hospital. Ask them what they want. They said, we want a bigger park. So what they did is build the old hospital where the park was, with green space on top, and the old hospital became a park. So you see a much larger park space, also a much nicer area to actually be. I think we should be looking what streets like this, where this Rambla de Poblenou in Barcelona. This is a street for walking and cycling with a lot of green space. It's much more pleasant to be here in the summer when the trees provide a lot of shade. You have people walking around. There's a real land use mix of shops and residential areas. And it's just a very nice environment to be around, or much nicer than many other places in the city, and also much more sustainable and healthy part of town. Recently, we published a paper describing many of these kind of issues. I think it's worth a read, and also I've been publishing a number of reviews describing this in much more detail. If you're interested, you can download it, or you can send me an email, and I'm happy to send you the papers. So hopefully I've given you a bit of an insight of what's possible, how we should change our cities to reduce the health impacts that we're seeing currently in our cities. Thank you so much.
Yeah, so thank you very much, Mark, for this presentation. And I would like to ask the participants to put their questions in the chat so that we can see who has a question, or just raise your hand for questions. Given that there is currently no questions in the chat, Mark, I would like to ask you to stop sharing your screen and maybe switch on your camera. And I have a question. What is your prediction to which degree the COVID pandemic and the digitalization will change these movement in the cities? Will it speed up, or will it pose a backdraw in the willingness to change the cities?
Yeah, I think it's a good question, and I don't know the answer, to be honest. I think what we've seen is that during the pandemic, particularly the lockdowns, I mean, people wanted to have more public space, more green space. They enjoyed more green space. City councils also introduced more cycling lanes. They introduced more space for restaurants to sit at. And hopefully this kind of trend will continue to get more space for people and less for cars. Also, what we saw, that people were working more at home, so there was less commuting going on, but that has changed now as well, I think, and people are coming back to the office in some countries, at least. I mean, others, they've gone back to their home working. And in principle, you know, teleworking should be good. I mean, less commuting, should have less of an impact. But then on the other side, what we've seen also during the pandemic is that people order much more online. So we've seen many more deliveries, the Amazons, etc., that are delivering at home, creating more mobility on the streets. And I think that's a bit of a disaster, because in a way, why do people like cities is because often there are opportunities to interact with other people, to go shopping, to have a shopping street to walk around and enjoy this kind of atmosphere. And like this online services, they're actually killing off our local economy. They're killing off our local shops. I mean, there are so many shops, what I see also here in Barcelona, that have closed because there was no business anymore. So I think there are changes, but which direction they actually go, I don't know. I was quite optimistic about 6 months ago or a year ago and during the lockdown, because I saw much less traffic. But if I look out my window now, there's a lot of traffic around. I mean, it's like nothing ever happened.
Mm-hmm. Okay, many thanks. So there are two questions regarding the Superblocks. One saying that, well, one asking whether they have been implemented, and then also questions regarding the health impact assessment associated with the Superblocks. I don't know.
Well, at the moment, there were 500 Superblocks planned, and the health impact assessment we did was to see if all the 500 Superblocks would be implemented, what would be the benefits. That at the moment, there are only 3 Superblocks implemented. There are going to be another 28 Superblocks implemented. And as you may, what we see at the moment is that, most people are in favor of the Superblocks, particular people that live there, but, there's also some resistance to it. And partly right, partly not, I think. What we saw recently, there was a modeling study coming out suggesting that within the Superblocks, air pollution levels reduced, but then around the Superblocks, the 30 that are planned at the moment, the air pollution levels increase. And that shows to me that, don't implement the Superblocks only part of the city, just go for the whole city in one go, because that prevents this kind of displacement of air pollution and of traffic. I mean, you need to reduce the traffic. Of course, I mean, the problem there is there's not enough money around that. The other things, I mean, yesterday there was a letter from the RAC, the Automobile Society, I mean, complaining that there were traffic jams. And then, more traffic jams outside the Superblock. And I'm thinking from, this car shouldn't be there in the first place. I mean, what are you complaining about? And so, there's conflict going on. There's a lot of discussion going on. The next 30 are being implemented at the moment. Next year, they should be in place. Hopefully that improves a lot. People will see the benefits, and hopefully we can go further in the city.
Mm-hmm. And maybe a final question by Peter. Peter, would you like to ask?
Yeah, sure. Thanks a lot, Mark. Really enjoyed your presentation. So obviously this sounds really good, and how do you implement it without sort of really just creating more sort of luxurious areas of the city, making sure that everybody in the city benefits from it, and like what I didn't write in the chat, the other thing you wonder about, for example, with the 30 zones, how do you make sure that you do get the mobility, still keep good mobility, going from A to B still it works in an efficient way?
Yeah, I think gentrification is always an issue. And if you just implement some of these new super blocks or green space in one part of the city, you can get gentrification. That's why I'm going for that. You need to distribute it all around the city and make sure that everyone gets the benefits of those new measures, not only a certain population. Then the 30 kilometer per hour, I think that should improve things. Like also for air pollution, most of the air pollution emissions are when cars are accelerating. If you look at a city like Barcelona, every 100 meters they have to stop because there is not a junction, and then they stop, accelerate, and they always want to speed up a lot. So, but if the kind of the speed is much lower, it's more considerate. I mean, you don't get so many emissions. I mean, it really goes down.
I would say also for noise, that's very important, because
definitely noise. I mean,
noise
you know, it's a lot of the motor engines make a lot of noise when they accelerate. I mean, it's dreadful with the traffic lights. How to implement or how to enforce is a bit more difficult, I think. And but you know, you can't always measure all the time. But then I think, you know, many cars get this ADS system now, the Advanced Driver's Assistance system. And on that, there is actually a button that you can set the speed limit, that the car sticks to the speed limit where it is, where the car is. Most people switch that off, of course. But in a way, what they should do is make it mandatory, put this ADAS in all cars, make it mandatory that the cars stick to the speed limit, and then we get around this problem. I mean, at the moment, these systems are there to protect the driver, not the people that are, you know, walking around or cycling. But you know, if you implement them also for the general public, this becomes much easier to enforce and implement.
Mm-hmm. So yeah, many thanks. There's one more question from Lucas, but I suggest that we take this question after Audrey's presentation. So Mark, many thanks, and I would like Audrey to start her presentation. We cannot hear you.
That's right. Yes, of course. I forgot to unmute myself. There you go. You should be able to see my presentation now. Is that right?
Yes.
Okay. So great. Well, thank you so much for inviting me. I'm really happy to be here. I think HERA is such an exciting project. So I was absolutely delighted to be invited and have this discussion with you. I'm very much looking forward to the discussion. So I was asked to talk about transport and health, and luckily Mark has covered a lot of the nitty-gritty of how transports and cities impact our health. I think we all know it's quite intuitive how transport has, on the one hand, direct effects on our health through emissions of air pollution and noise and traffic injuries and sedentary and versus active lifestyle. So all those things that Mark has already mentioned. And also he's already mentioned how the way we transport ourselves and the way we design our cities for transport has impact on land uses and urban design. And that has an impact on accessibility. So who has access to what and where and how, which has impacts on inequities, but it's also the opportunity for green space that's taken away through the different means of transport that we have in place. So we have lots of different impacts of transport, and I don't really want to dwell on all the details of these different linkages, because I thought that it might be more useful to think about, of course, there's all of these have loop back effects, and there are feedbacks, and there's synergies and trade-offs. And rather than dwell on all of this, I wanted to be thinking more about what is it that we can do, particularly as researchers, but also in policymaking, to help those transformational changes towards sustainable and healthy transport. And what I like to suggest is that we really need to take on much more, both in research and in decision-making, some systems thinking approaches. And systems thinking, what it does is really help connect all the dots, think of the system as a whole and the problem of transportation and health as a whole and as a complex whole, so that we make apparent all these linkages and trade-offs. So I think systems thinking will have benefits in 3 different ways. One is it can help us highlight the co-benefits or positive synergies of different transport solutions or urban design solutions. It can help us identify the unintended consequences and trade-offs, but also something that we, I think, often forget about is how we need to engage society with us in these transitions, and particularly if we want them to be transformational. And I think this systems thinking approach that does create an understanding of how all this fits together is a way to engage society. So what I'll do now is just go through a few examples. It clearly cannot be exhaustive in 12 minutes. And thankfully, Mark did show a lot of these already, but just a few examples to highlight these different aspects of co-benefits, trade-offs, and engagement. And I'll I'll base these on some of the research that we've done and others have done. So why do we need to create those co-benefits, make those co-benefits more apparent? I think it's because we tend to have very narrow-minded approaches in the way we make decisions, partly because of our institutional system that's where departments work in silos. And to take an example, when it comes to air pollution, what is it that we mostly think about? Well, we think about implementing technological solutions, getting people to buy electric cars instead of diesel or petrol cars in particular. So what happens when we implement those, what is seen by many people as the solution to air pollution? What happens? Well, we have those cities that are full of cars. And if we replace every single one of those conventional vehicles by an electric vehicle, are we really going to be much better off? And yet, clearly, we could do a lot better than that. And thankfully, some cities are leading the charge and showing the way in making those changes happen. But however, a lot of people think that electric vehicles is what's going to be changing, saving our planet. And so I think we need to create those the research and evidence base that demonstrate that we can get more out of our transport solutions. A few examples. This is an example from a work that we did in Barcelona many years ago with Mark, where we looked at the impacts of removing 40% of car traffic in the city of Barcelona. And of course, we do get measurable health benefits from in terms of air pollution when you remove 40% of car traffic. About 10 deaths were avoided every year thanks to this transportation scenario. But then if you think a bit more broadly, not only about air pollution, but you think, okay, well, actually, we can shift these car trips to walking and cycling, and let's look at the health benefits of that. Well, we find close to 7 times the health benefits thanks to the physical activity benefits that we get from promoting walking and cycling and public transportation, which all have physical activity. And as Mark showed earlier, we certainly have a major public health challenge with physical activity. So this is a way to get much more out of just one single policy, yes, for air pollution, but has co-benefits. A more recent example, and of course it has impacts on climate change as well. A more recent example is a study that I conducted with one of my PhD students in London, and there we compared some of the air pollution strategies in London. This from the previous mayor. We took some of the specific strategies that were in the mayor's air pollution strategy, and many of these were or most of these were technological solutions. So a lot of the focus in London is on technological solutions rather than behavioral solutions. So we looked at technological solutions, low emission zones, electrification of vehicle fleet, changing diesel cars to petrol cars. And then we compared these with behavioral solutions, cycle paths, and then car reduction strategies, mode shifts to walking, cycling, and public transportation. And what we see here is that on the x-axis is the number of deaths that are avoided. And what we find is in blue are the deaths avoided thanks to changes in air pollution. And in yellow, the deaths avoided thanks to physical activity. Now, clearly, even when you take the best of all the electrification, the best of all technological solution, which is the electrification of the entire vehicle fleet, you compare that to the behavioral solutions, which can be just a few more bike lanes or up to 50% of mode shifts, you still get 2 to 15 times greater health benefits from the behavioral solution, again, because physical activity is such a driver of health in our society. So again, if we just only look narrowly at air pollution, we might decide, okay, electrification of the vehicle fleet is the way to go. But if we look broadly and think, well, what's the aim of these policies? Is it air pollution standards or is it health? Well, if we think broadly, we see that solutions that emerge are quite different than the ones that are just narrow-minded. A Of course, it's not just about air pollution, physical activity, major or traffic injuries, all three really major drivers of health, as was shown also by Mark. But there are lots of other impacts of our transportation lifestyles, our transportation solutions and policies. And the importance of some of these impacts is not just in terms of the health burden, but it's also in terms of how people feel about themselves, how people enjoy their lives, how they're engaged by different solutions. And I think we need to think a lot about what it is that's going to be the je ne sais quoi, that's going to be engaging, that people are going to want to grasp on and want to desire for their own cities. So those, I think, those images express these a bit. Now we can also have some research that shows some of these types of health benefits. To give you just a few examples, I think a lot of us associate living in cities with stress. We have stressful lives in our daily activities, so we are constantly looking for ways to reduce our stress, which is also, of course, an important health determinant, but also something more about our quality of life and something that all of us want to help deal with. So we did a study as part of the European project PASTA, where we looked at the impacts of different travel modes on stress. And what we found is that cycling versus any other activity reduces significantly while we're cycling the stress level as measured by a sensor of galvanic skin response. So cycling in green in this graph reduces stress by 11% compared to all other activities. Walking also had major health benefits, or major stress reduction benefits, or less so than cycling, but still statistically significant. While as motorized transports slightly, of course, just a tiny bit, but increased, statistically significant, slightly increased our stress level. So again, those are things that I think people might be engaged in. What other things might people be engaged in? I think a lot of us are struggling with our weights, and we might be happy to hear that one way for us to reduce our weight is taking up cycling. So again, in the PASTA study, we saw that for people who cycled, the more they cycled, the lower their weight was, while as people who drove, the more they drove, the higher their weight was. On average, we saw a 4-kilogram difference between the drivers and the cyclists. And we saw that over time in our longitudinal analysis, the more people cycled, the more they decreased their weight, whereas others did not. So again, something that might be engaging, a public health concern, but also something that people might grasp and be engaged with. Other things that I think we're, again, Mark touched upon, what is it that we can do with the space that is taken up by cars? It's not only the type of activity and the impacts of a specific mode of transport, it's also the opportunity cost, the opportunity of using the space in cities differently. So here's an image of a little boy during a rainy car-free day that was tweeted. And it was rainy and gray and cold, but yet kids just loved to be able to run around in their street. Mark so importantly pointed out the importance of creating spaces that are also for our children, and play spaces for our children is something that really we desperately need more in more cities. The bottom picture is a little girl enjoying a parklet that was just a demonstration parklet during a festival, really loving replacing a car with green space just for 3 days. What joy did that bring? Mark talked about the Superblocks, again, removing cars, creating play areas for kids, green space, etc. And all of these, Mark has already shown the impacts on in terms of health. Something else I think that can create alliances across lots of different sectors of society is how do we address inequities? We all know how, and those images tell us very clearly how our transport systems has impacts on inequities, on vulnerable populations, on opportunities, access to employment, etc. Can we use transportation and a goal of reducing inequities also as a rallying cry, as something that we can create alliances around? And it always surprises me how air pollution and air pollution transportation solutions to reduce air pollution are often actually combated against because people think that we can't. It's regressive to try to. It will create more inequities if we prevent people who own cars to drive because they're too poor to do something else. Well, we look at this, for example, the study in the U.S. We know that the people looking at ethnic disparities, the people who cause air pollution are not the ones who are exposed to air pollution. The Black and Hispanics cause a lot less air pollution, but are exposed to a lot more air pollution compared to whites who cause more air pollution and are exposed to less air pollution. Huge inequalities that we, of course, all are aware of. In the UK, we see that in neighborhoods that have less access to cars, there's higher levels of air pollution. So clearly, through transportation, we can do a lot more to address inequalities. Trade-offs, I think that's something that the systems thinking approach can also highlight. We all know the disastrous impacts of promoting diesel cars versus petrol cars. Again, showing you some results of the my PhD student who looked at those this transportation scenario. Annette, are you appearing because I'm running out of time? No? Okay, good. I just want to make...
So yes, it's like 15 minutes by now.
Oh my gosh. Okay. Well, let me just then quickly say electric vehicles, of course, they will have an impact. They might have some benefits, but there's some trade-offs in terms of the mining of cobalt, in terms of the infrastructure that's put in place that might create some lock-ins. I will skip this just to finish by saying we really need to highlight how we can engage society, how we can engage decision makers, and I think the systems thinking approach really can help bring this together and demonstrate our way forward. There you go. Thank you very much.
Audrey, many thanks, and I would like to invite questions now, and first invite Lucas, who had a question. How to engage people in Prague to make them cycling. I think that is now a good time to ask this question.
In Prague in particular?
Yeah, so Lucas, do you want to come as a camera online?
Yeah, okay. Hi, thanks for both presentations actually. No, in Prague it's, you know, we're building the pathways for cyclists, but still too few people are cycling. It's partly because Prague is quite a hilly place. It's not flat, it's hilly. So they say it's one of the obstacles. But are there kind of incentives, you know, like to get people on the bikes, you know, explaining them the health benefits? I know, but it doesn't work usually that much. How are there any research-based incentives? Thanks.
Yeah, I think a lot of people don't cycle because they're afraid of cycling, and especially parents with children, especially women, are scared of cycling. So I think the first thing that needs to happen is to create a safe environment for everyone to cycle, not just young men wearing lycra and VisiVest, as is what we see mostly here in London, but a safe space for everyone. So it's rather than convincing people, we first need to convince the decision makers that they need to create that space. So that, I would say, is the number one. But of course, I think that people do cycle for different reasons. So once you have created that safe space, you need to just, there's a component of actually, as you say, you can promote cycling by showing the health benefits for yourself personally. You can also show the impacts on climate change, on air pollution that has negative impacts on others. I think different people are going to be motivated by different things. So I agree that there's a component that has to be really hard measures of making cycling more attractive by making it more comfortable and more safe. But there's also more soft measures of increasing awareness and I think to rally everybody towards that same goal is showing this vision of what cities could look like, demonstrating that we have all this to gain. It's not a sacrifice to try to reduce cars. it's actually a benefit for all of us to be able to live in much healthier and happier places.
Thank you.
So many things.
Just in terms, and I just say in terms of hilly places, I know there are hilly places that are cycling friendly. We now have, of course, electric bicycles, which can of course help promote cycling in places that are hilly. And what we do see from our research is that people who use electric vehicles tend to get as much physical activity as people who use conventional bicycles, and not electric vehicles, but electric bicycles, because they go much further distances and maybe hillier distances as well. So of course we don't want to replace conventional bicycles with electric bicycles, but it is an opportunity for people who wouldn't be cycling otherwise.
Okay, no, great, because that would have been one of my questions. You were kind of clear, and it's in your slides what to think about electric cars in terms of air pollution trade-offs, but then the electric bikes do not seem to be so bad, right? I mean, depends on, or is there already, do you have already conducted like impact assessments for electric bikes versus conventional bikes and shorter, longer distances?
So we did do some research as part of the PASTA study, and others have done the same, to look at the physical activity impacts of electric bikes. And we did find, as I just said, that there's the same level of physical activity because people who use electric bikes tend to go much further. Now, this was based on not so many people, so there could be some, now that the electric bikes become more popular, maybe people would replace conventional bike, which would then be a disbenefit. So of course, there's a risk that this is not as good for people, but so far we see rather benefits than trade-offs. I don't know if anybody has done a health impact assessment. Mark might have, I don't know.
Okay, maybe we just take the last question from Christine and then we move on. Christine, do you want to come online?
Sure, thanks. Thanks for a very interesting talk. My question is related to winter cycling. As I wrote in the chat, how can we solve the problem when you have large seasonal differences? I mean, I really enjoy, or I favor the thinking of using bikes and electric bikes, but in Norway, I mean, it's really harsh in the winter. So it's basically only for the strong and healthy. So that means that there will be large differences. So how to deal with that when you plan in the city?
Somebody once told me there is no bad weather, there's only bad gear. So of course that addresses the problem for some people, not for everyone. But there are places out there that are really cold and snowy, and yes, the infrastructure is in place and people have their gear and they can still cycle. It's not a solution for everyone, but we need to make sure that the infrastructure is put in place and the maintenance is put in place so that bicycle lanes are well maintained, because it is possible. Having done it myself in Kuopio in Finland, it is possible to bike on snow.
I know, but well, it was a seasonal difference. That was the point.
Yeah, so Audrey and Christine, many thanks. I think this was really highly inspirational, and we now move on to the presentation by Dorota, who will tell us about the WHO equality guidelines. And yeah, Dorota, the floor is yours.
Thank you very much, Annette. I hope you can see my screen now. It's not yet full. Okay. Yeah.
Yes,
okay.
We can see and hear very well.
Lovely. Thank you very much. So we have now heard two great and really inspiring talks about health supportive cities. And there the question of air quality and health has been really embedded in a wider picture, and this case for the integrated approach has been very prominent, looking into many co-benefits and synergies. with this talk, I would like to get us back to the heart of air quality and health, and to say a few words about the new air quality guidelines, which are very much focused on few pollutants, air pollutants, but the guidelines as such are very important for the considerations of which we have heard before. So let me just remind what the WHO air quality guidelines are. So this is a set of WHO recommendations formulated as levels of air quality that is necessary to be achieved to really give this protection of public health worldwide. Per se, they are not legally binding standards, norms, but they provide an evidence-informed reference to be then taken up by decision makers to develop standards and policies. And it is also an instrument that is meant to support the design of the measures that would be really effective in reducing air pollution and better protecting human health. And this is also a tool to stimulate further research. WHO has been publishing air quality guidelines since the late 80s, and the work on the current update started 5 years ago, and there were several drivers of this update. The main one was really progress in science, and the new body of evidence that accumulated since the publication of the guidelines in 2006. Of course, there are very many features of this new scientific evidence. The main features was that we got studies from different regions of the world, so covering much wider spectrum of air pollution levels, exposure levels, also many multi-center big studies which are contributing to really gaining very robust evidence. Also, because of the developments in monitoring, modeling, much better insight has been gained to the global picture of concentrations of pollutants, and also a much better understanding of the magnitude of this public health relevance, so the assessment of the global burden of disease attributable to air pollution. With this came also this reinforced recognition of pertinent inequities when it comes to health impacts of air pollution. The previous 2005 air quality guidelines were also picked up in many member states, and they also were a very important stimulus for several policy decisions at the international level, reflected then in the resolutions of WHO or resolutions of the UN Environmental Assemblies. So what the new air quality guidelines provide? I believe that many of you might have already seen the numbers. So let me just remind that the document provides new air quality guideline levels for PM 2.5, PM10, ozone, NO2 and SO2, and these new revised air quality guideline levels are marked in green. In most instances, the currently defined air quality guideline levels are lower than they were in the past. And the guideline values for 2006, you see here marked in red, because now they became one more interim target. Already in 2006, the interim targets were introduced, and they are retained in this edition of the guidelines, and the previous air quality guideline values became the next interim target. There is also a very new feature in the current guideline document, which are the good practice statements. And they address several types of particulate matter pollution, which was very extensively discussed in the process of developing the guidelines, but for which the evidence was too diverse and was not sufficient to follow the process to derive the numerical air quality guideline level. So more qualitative statements are formulated. Few more words about the interim targets. Keeping in mind that the guidelines are of global application, there are places where the current air pollution levels are very high, so this distance between the harsh reality of today and the ambition of achieving air quality guideline level, this distance is very big. So these interim targets, they are to facilitate actions in member states. So by setting the values, it's like stepping stones on the way towards improving air quality to the desired level defined by air quality guideline levels, and to indicate this gradual improvement. Mark has mentioned the words of Bird, that the guideline values are ambitious but not impossible to be achieved. And yes, we strongly believe this. At the same time, this helping hand is needed in some parts of the world to support the efforts to improve air quality. The good practice statements that are contained in the new air quality guidelines focus on sand and dust storm, black elemental carbon, and ultrafine particles. And I think that in the context of the European discussion focusing on cities, in particular, black elemental carbon and ultrafine particles would be of prime interest. And not going into the details, these good practice statements, they contain some pieces of advice and guidance how to enhance and expand monitoring systems to better capture information related to those types of particulate matter. At the same time, even without providing numerical guideline values, it is already indicated some actions to be taken to either collect more specific information, but also now to take measures that would reduce exposure to these types of pollution, and also formulating some suggestions for better utilization of new technologies and scientific developments. All these measures are expected to provide more specific information that in the coming years could lead to formulation of numerical values or more specific guidance related to these types of particulate matter, recognizing their relevance and already available information of their health relevance. We are very confident that the guidelines developed are very robust, as the process of their development was very rigorous. Following the scoping of the guidelines, there was a systematic review of the accumulated relevant evidence, then the process of grading this evidence, assessment of the certainty in this evidence, and then a methodological approach to develop recommendations, so to formulate derived guideline levels based on this reviewed evidence. And there were several groups of experts involved. And just to give an idea that altogether it was more than 100 people involved, the main responsibility was with the guideline development group and also colleagues who conducted systematic reviews. And responding to these nice welcome words from Annette, it's really has been a tremendous effort of all those experts and stakeholders involved, and that really needs to be gratefully acknowledged. Throughout the process, the systematic reviews of evidence for the defined questions were also published in the special issue of Environment International, and also some additional methodological developments related to the development of a dedicated risk of bias assessment tool, and also some guidance on the application of the framework to evaluate the certainty of evidence. They are also published to give a full traceability of the process leading to the development of the guidelines. And finally, some very rough exemplification of how the guidelines can be used. So first of all, as these evidence-informed tools to support policies and actions at different levels, because in this community it may be obvious to repeat that measures to improve air quality and better protect health require actions that involve multiple sectors, multiple stakeholders that need to be taken on multiple levels from global to city level in multiple timeframes, but then with the expected multiple benefits in terms of health, well-being, and also reduced inequities. And here I think the many ideas mentioned in two previous talks fit very well when zooming in on actions at the city level. The guidelines are also a stimulus for further research, and while the evidence is robust and solid to take urgent action, there are still some gaps which might be filled by the future research that will help us to take even more fine-tuned actions and interventions to address the challenge of air pollution for health. And last but not least, in line of this more integrated thinking, we cannot forget that air quality guidelines, while setting specific levels for specific pollutants, as such are also a tool that may be used to promote the climate action, stressing these synergies and health co-benefits of targeting sources of air pollution also as measures of climate change mitigation. And with this, I would like to conclude, acknowledging also all supporters of the work on the guidelines. Thank you very much.
Yeah, so many thanks for this excellent presentation. And Andre has a question. Andre Mikesh.
Thank you, Andre. Yeah. Hello, thanks again for the presentation. I just wonder, when I was checking the new guidelines, I have found out that the SO2 guideline was raised actually by 100%. What is the reason for this increase? Thank you.
Yes, indeed, this is the only case when the current guideline value is higher than the previous one. This is based on the assessment of the new evidence that has been collected since the publication of 2006 report, and then following the very same approach of deriving the guideline value. These were mainly related to all-cause mortality and respiratory health endpoints. The decision of the GDG was to set the guideline value as the 40 micrograms.
Mm-hmm. So thank you. There are two more questions in the chat, one by Franziska and one by Audrey. Maybe we take these following each other. You may post them yourself, Franziska, and then Audrey.
Yes, good morning. Good morning, Dorota. Hi. I would like to know, as in Europe with the Green Deal, there is quite a number of strategies and actions plans coming into place, how the WHO air quality guidelines would relate, for example, to the zero pollution strategy and how they can support each other in terms of implementation. It says improving air quality to reduce the number of premature deaths caused by air pollution by 55% in the zero pollution strategy. So how does this relate in terms of the targets in reduction? And you said that the air quality guidelines can be used for development of legislation, for example. So how does that work together? Thank you.
Thanks. I think, of course, this is extremely important question. I think that we are seeing now the beginning of this debate in the European Union, because the guidelines have been now picked up in this discussion, which is now starting about the revision of ambient air quality legislation. And there is quite an intensive discussion now, seeing the guidelines as a reference point. And I was seeing, and I believe that many of colleagues have seen presentations by the European Commission, which is now formulating these different levels of ambitions in the prospective revision of the air quality legislation, using be it interim targets and the air quality guideline level. So I think we are just at the beginning of this discussion. I hope that this ambition of the European Union with zero pollution will really get this discussion and the revision of the legislation as public health protective as possible, because this is indeed also seeing the totality of the pollution issue rather than focusing on specific pollutants. So this is now the time that the discussion is going on, and we are happy to be part of this discussion, and also happy to see that the guidelines are explicitly taken on board and considered as this reference and point and ambition point.
Mm-hmm.
Thank you.
Thank you. And there's Audrey has another question. So we take this as the last one and then move on. Audrey.
Thanks. I was wondering how you felt about the average exposure reduction factor as an approach to legislating. So instead of having just standards, like a hotspot approach, having a population approach, so that everywhere there's an incentive to reduce air pollution. What's your take on that one?
Mm-hmm. Yeah, I mean, you know, the guidelines as such, they are saying, okay, this is what should have been achieved universally to get population protected. So this is what the guidelines are saying. And then, of course, the approach to legislation setting, this is more part in the policy decision makers arena. But keeping in mind that we really would like to have the health of everyone protected, and thinking of, you know, reducing these inequities, any legislative approaches should be tailored to really protect everyone.
Mm-hmm. So excellent, many thanks. And with that, I thank you all dearly. I would like to ask everybody to switch off cameras and microphones for the last bit of presentation, where I will take you to further into the HERA agenda, highlighting the area of air pollution, which is still a global problem and one of the major problems. And as Dorota has pointed out so nicely, there are these regulated pollutants, but there are also unregulated pollutants, such as the ultrafines, which are emitted as very small particles, and then they form the fine particulate mass, and they absorb substances And we breathe these particles together with the gases. And it's the barrier organs where the interaction with our bodies appear, and where, for example, the particles can elicit inflammatory responses, but also may be able to elicit systemic responses, especially if they are ultrafine, which brings us to the notion that we have effects at the barrier of the lung, but also systemic effects throughout the entire body. And we have seen before that in an urban city, this is really complex because you have all these influences, but on a body level, it's also complex because our cells are exposed to many environmental stimuli. And it's important to think, so one thing is to think on the outside and how to implement measures, but also to understand the impact on the cellular level. And so one idea could be that to start to understand the joint impacts on the molecular level and use an exposome concept so that one can quantify the potential many diseases which are impacted. And the analogy which one may take stems from an idea how to explain aging on a cellular level and by joint common pathways. And it turns out that actually air pollution drives many joint pathways with aging, such as inflammation, such as DNA adducts, such as epigenetic aging and mitochondrial dysfunction. But we have also other areas such as endocrine disruption, aging-related secretion, the reduced diversity with microbiomes, and an autonomic or nervous system function, which is also attributed to air pollution. And this is why that even though we have now the air quality guidelines for Europe, and we are hopefully that will get much better air quality standards in Europe for the future, we think that there's research needed to further sustain these developments and also to make the right choices. So one idea is that when the WHO guidelines was set, it was based on mortality and a certain limited set of outcomes. But by now we know that also, for example, the reproductive system is affected and potential also very early child health. And therefore we think that there is need to further understand the impact of or what is healthy outdoor and indoor air for children. So to understand transgenerational effects and also the early impacts on children and potentially also in combination with particulate matter, gaseous pollutant, but also household chemicals, so that we have a better understanding of the critical developmental phase of the children. And again, we also think that while the air quality guidelines are set on the epidemiological evidence for implementing measures, we also need toxicological support. And similarly, we think that for air pollution, we currently in the health impact assessment, as we heard is a very nice tool in Mark's presentation, we are maybe only scratching the surface for air pollution health effects, because we basically look where we had the data so far, but there are other areas where there is more and more emerging evidence. And it's also to make it part of a strategy, of a preventive strategy, we need to somehow explain to our more biological oriented colleagues how this is really impacting. Another area which Dorota has so nicely also described is the co-benefits potentially with climate change mitigation strategies, where we need more models, more understanding of the mechanism, how this jointly applies, and then apply to population-based studies. And therefore, also following the idea already raised by Franziska, we think that there should be specific research which kind of looks at the climate change mitigation strategy and the zero pollution action plan and quantifies the co-benefits of improving air quality, so that we have a quantitative support that the measures taken are the right ones, and so that we can guide the process and again enforce it to have double wins in this area. And then finally, also, while I thought it was really inspiring, the talk by Mark and Audrey, we'll be looking at a number of technological solutions. And I think it's very important that these technological solutions are also supported by health research, where there is the will to implement it. So, for example, if we are now replacing ship fuels again, it would be very important to see that we are not buying in other toxicological or other stressors. We will be looking at many sectors where combustion processes will be changed and altered. And for example, we have evidence from our time when of the German reunification that actually the period when the particles in Eastern Germany were most hazardous, it was when there was the switch from brown coal to gas. And we see needed transitions, but we need to have them in a right way. And so we highly recommend that you go to the research agenda of HERA and use it and possibly amend it, build on it in the various settings and support it so that we have more calls within the European Union on climate change, environment and health. And with that, I would like to thank the HERA team, and I thank you for your attention, and I'm happy to take questions, but also if you have other open questions, please go ahead and also involve the other three speakers. Katka.
Yes, thank you very much, Annette. It is not necessarily a question to you about HERA and development, what you've nicely summarized, what are the research goals. I mean, indeed, we are looking also for practical changes, for transformational changes or systemic changes, and I was really intrigued by what Audrey has been presenting. So I think this is a question for maybe to all speakers, because all of you have ample experience in doing research in this field and also interacting with, you yourself, you interact with cohorts. Mark and Audrey do that in their respective cities and countries they work in. So my question would be how, and in terms of that systemic change, maybe, how do you persuade the city councils, for example, to make those changes that your research is showing to you? You know, I understand, clearly the benefits of cycling, creating the green spaces, but what is the trigger that makes the decision makers, buy it? That would be very nice to hear from you. Thank you.
Mm-hmm. Audrey and Mark.
Are you going first, Audrey?
Okay. I'm going first. Thank you. That's a great question, and I think there's a role for us as researchers to, every time we start a piece of research, to have a co-production model so that we reach out to the policymakers and we integrate real policy questions and policy needs into our research process, so that we actually are ensure from the start that we're asking the right questions, and then we're producing as we go along the type of evidence and the type of arguments and facts that are going to be needed by policymakers. Of course, that takes a long time, so we don't want to just wait for this long process to happen before policies are made. But I think we certainly have that role to start to change the way we develop our research from the start, using co-production models. And then I think we just need, again, as researchers, be much more engaged with the politics throughout. And then finally, I think we again, as researchers, need to develop the type of evidence that will be engaging with members of the public, with society, so that they put pressure on the politicians to make things happen. So I think from all angles, that's again, I speak from our role as researchers. I guess that's the what I understand best, but I'm sure there are other things that can happen in terms of institutional settings. Just to simple things like having somebody be jointly associated with the Department of Transport and Health, for example, or having a shared budget, or even having offices that are in the same building. All these things will little by little also make the changes of people talking to each other and then creating those synergies.
Mark?
Yeah, so I think as a researcher, I always say to other researchers, we need to have the evidence ready when policymakers need it. I mean, because, you know, they have a very short agenda and they want to have the answer tomorrow. So you need to look at what are the issues that are coming up that they probably want to address, and they want to have the numbers for it. I mean, and you know, that's one of the reasons behind the website that we did, the isglobalranking.com, just come up org, sorry, to give the health impacts. Now, more on a local level, I must say that I'm kind of lucky that I'm living in a city that has a fairly progressive council. I mean, and also council members like Janet Sanz, who is responsible for urban planning, who want to actually make changes. I mean, and what we've seen here in Barcelona, they're introducing the Superblocks, but I think it's a great initiative. They want to have more cycling lanes. The cycling lanes have increased from about 120 kilometers in 2015 to 275 in 2023. They put roads underground to put a park on it in Plaza Glorias. And so they would like to do more. The problem for them is that there is not enough money around to do these things, first of all. The other thing is that also there is some resistance from special interest groups. I mean, yesterday, I mentioned in my talk, the RAC, the Automobile Society, complained that there were traffic jams near where they put the Superblocks down. I mean, and also that there may be more in the future. I mean, the shopkeepers, they're complaining because there are no cars in the street. I mean, actually, most of the time, the evidence is the opposite. I mean, when they make these kind of things, the environment will improve. People are shopping more and this kind of things. But it's still this kind of perceptions out there that it may have the effect that they don't want, and then also here the car industry is quite powerful, so they want to have space for their cars. So it's more them, and we're signing up more with the city council. So every time we publish a study on the health benefits of reducing air pollution, increasing green or whatever, the city council say, great, well done, nicely published. I mean, so we can use that actually to say, look at this, what are the arguments? But of course, it's a very complex issue, and the economic interests are often stronger than the local government interest or the people's interest for that matter. But, it's just, it will keep me going for many years, I think. And that's why I don't have any retirement plans and just keep producing evidence and also interacting with them, as what Audrey says. We have regular interactions with different groups, go always out there. It's a pain, of course, because you want to write a paper, but you need to go out to talk to them. But I think it's worthwhile in the end.
Mm-hmm. Dorota?
Yeah, maybe not very much to add, but I think it's like a Benedictine process of building the argument, also helping to quantify the health argument. So from the WHO perspective, it is benefiting from the research, translating into the tools that countries can use. So it's to really empower those who stand for health to show not only the health impacts in these negative terms, but indeed these health benefits. And I believe it's also important to go a bit more into this behavioral change aspect, not only at the individual level, but these behavioral considerations to get a better understanding of the needs, priorities, and possible action points in different stakeholders. I guess there is this need to go even more beyond the specific thematic domains to try to find really these best triggers for action. Thank you.
Mm-hmm. Yeah, I would also, from the perspective of writing the HERA agenda, I think it's really to find these transformational change points, but then also to, in a way, find the right languages or find the right co-creation project. So as Audrey said, you can do it with a policymaker, or as Mark described, you have a role model or a model where simply the city has the ambition to change things. And then what I was describing, doing research which reaches out to the medical societies, which kind of makes that we think air pollution is important, translated to what they are thinking about when they think about treating patients. And I think there are these kind of, we need to find, so in order to have awareness and awareness of communities who can do things, we need to find their triggers, which is relevant to what they do. So whether it's planning their city, or whether it's treating their hypertensive patients better, it's kind of different stakeholders to whom certain things matter. And we need to find, when we design our research, so sometimes we need to co-create with citizens, sometimes with the city council, sometimes maybe with the governments and other stakeholders, so that our research is meaningful. And I think we are in a time through the COVID pandemic that we get as researchers a lot of attention currently. So we really need to thrive on that for the big environmental and climate change topics. Mark.
Yeah, I think what we're lacking a bit is kind of more this area of implementation science. We've been more working on the kind of research, exposure effects, but how then to implement, in the future or currently, I think that's what we're lacking. And that's where we should actually much more effort there, just, the part of knowledge translation, but how you interact with stakeholders, what triggers people to do things. I mean, I see here in Barcelona, they focus a lot on kids at the moment because people, they have a soft spot for kids in a way. And that's why we're going to have this traffic reduction zones around schools, around the city, around 200 schools in the city. But these schools are also strategically placed. So if you reduce traffic around the schools, you reduce it for the whole city in a way. So, I mean, and that's an access point that people can't really argue with so much, because we all want to do well for the kids. But, what is it? What makes people tick? I think that's what we need to, or policymakers or funders tick. I think that's what more research we actually need.
Mm-hmm. So this kind of nearly brings us to the end. I would like to take the question, the last question by Francesca on the food environment. Would you like to come online quickly? And
hello. I work for ICLEI, which is a network of local governments which help the city environment to be more sustainable. And so this discussion was really interesting, and I will report the outcome also to my colleagues. And yes, I was wondering if there will be a follow-up also for the connection between urban food environment and health, which is actually my field of work in the organization. Yes, just a curiosity.
I think that's great. I mean, that there's quite a bit of work going on. And by food environment, do you mean shops, or do you mean also urban gardening, etc.? Because I mean, there are two different aspects. But for both, a lot of work is going on. And for example, I know the Expanse project, a number of people from here are in there, where we try to produce maps and also research in relation to the food environment, healthy food, bad food, this kind of things. But also there are other projects like Go Green Roots, where they look at urban gardening, what is also quite popular. So I think within you also, the nature-based solution project with the urban gardening, what always comes in. Of course, we love ICLEI, and I think we're working with them, and it's great. But I'm happy to bring you more up to date with the research in the different projects.
Mm-hmm. Thank you. Yes, it was a general question about urban food environment. Yes, thank you. We'll investigate about your research. Thank you.
And a special session may be good, a webinar. Always happy to.
So many thanks for the presentations and also the questions. It brings us to the end of this webinar. I think we have, in a way, exciting times in front of us as we have the Green Deal within the European Union, as we now have the air quality guidelines which guide us and are quite ambitious, but we think possible, and that we have this kind of integrated vision of research which looks at the cities as one of the major places in a very complex way and addresses the many issues which are there or already now, but that we also see implementation science as a major task ahead of us. And this is really at the core of the HERA agenda. And with that, I would just thank everybody, the presenters, those who asked questions, and those who listened to us. Take care and have a great weekend and a good year, and do great research or fund great research.
Thanks so much. All the best.
Thank you. Bye.